So just to use the example of what research shows for gay, bisexual, and other men who have sex with men, there is some very strong evidence, including some stuff from the States as well as in Canada, that really demonstrates this connection. So what we know that for many gay, bisexual, and other men who have sex with men, there are significant stressors related to experiences of marginalization that are not necessarily always unique, but some of them are unique to sexual minority peoples, including experiences of homophobia, discrimination, intolerance, violence, rejection from family and friends, and then institutional barriers around access to healthcare, all being particularly important social conditions or factors that affect the health of gay men. We know that then this in many men leads to a kind of response, so regulating the emotions, substance use, changing relationships, social and personal relationships to try to protect yourself from things, internalizing that stigma that you're experiencing or concealing your sexuality, and that's kind of how that response happens. This then leads to various forms of mental illness, including anxiety, depression, suicidal behavior, substance abuse, alcohol abuse, and this is sort of a domino effect that they all then snowball into sort of this syndemic of conditions. And then we know that that is related to risk behavior and then ultimately to HIV. So there certainly is very strong evidence that demonstrates that this path does happen for gay and bisexual men. The other thing, though, is that there are clearly protective factors that are underlying these, and these include social supports, having supportive environments such as schools, safe schools for queer teens, for example, social or peer norms, personal strengths around self-efficacy, being out, having protective coping mechanisms, knowledge and adoption of safer sex skills, and supports from community organizations, being connected to communities or having those supports. And again, so these are where we're trying to focus on trying to really build up these protective factors to prevent these sort of adverse health outcomes from happening.